Good afternoon. Hey, I wanted to welcome our listeners and our viewers here today. We're talking with Concordia Anesthesiologist, and Dr. Jarrod Huey was going to be our guest, got stuck in the operating room. So David has agreed to jump on and pinch hit. So David, thank you so much for being available and jumping in here to talk about Concordia and what y'all are doing in anesthesiology management. So
Thanks for having me. I appreciate it.
Awesome. So let's talk about, give our viewers an idea of who Concordia is and the kind of people, the type of clients you serve.
Yeah, so Concordia is a boutique anesthesia management firm. Been around for going on our 11th year, 11 years strong. And our preferred client, our typical best partner, is small rural hospitals, ambulatory surgery centers, and office-based anesthesia practice management solutions. Those are our key. We are prepared to scale and address larger hospital markets when those opportunities arise. We've spent a fair amount of time and effort in developing our scalability process to expand into that market very readily and with relative ease.
I know you, what you talk about a lot is improving every outcome. Share with our viewers what that really means for your clients.
So improving every outcome basically means every engagement, right? Whether that's the management side of things in terms of contractual development, cost issues, revenue cycle management issues, down to the intraoperative patient management and being a good partner in the operative suite to the patients, to the surgeons that we serve, and then also to hospital administration. So improve every outcome for us specifically means every interaction that we have with our hospital or ambulatory surgery center partners and the patients is a good outcome, is the best outcome. That's what we mean by that.
That's awesome. And I got the cart before the horse, but I know your role within Concordia Anesthesiologist. Share with our listeners what your role is.
Yeah, so years ago, I was and still licensed as a clinical anesthetist. I have a clinical background. Currently, my role with Concordia Anesthesiology is the Chief Operating Officer. So basically, every facet of business management, business development, partner management, expectation management, all of those things fall into my purview. And it's a pleasure to do it.
I know you were sharing with me a couple weeks back, when it comes to the operating room and what y'all perform within the anesthesiology part of it, there's a lot of moving parts. And obviously if a center is not doing what they have scheduled and something falls through the cracks, then there's a lot of lost revenue. What are some of the things that happen, when you're not doing what is needed to do and what y'all do as a smaller boutique management practice?
That's a great question. I think one of the significant things that we bring to the table, both coming from a clinical background, from a case management, case flow, operating room efficiency type of mindset, the clinical application of anesthesiology in the OR suite, and then balanced against the business side of medicine, right? So I think what we deliver on most significantly is the flow. And we recognize that from every point of entry in the perioperative process to perioperative patient assessment, the anesthesia preoperative evaluation, getting the patient appropriately ready for surgery, all systems evaluated, if specialists need to be consulted, appropriate lab values, and we do that in a stratified and risk management sort of way. So if it's a low risk procedure, maybe you don't have to order all of this comprehensive lab value. So we balance the getting the patient ready against the cost to do that, all the while trying to mitigate against same day case cancellation. So we do that through a perioperative surgical home process, and that can be done as just a consultant type of approach to a hospital's already preoperative process, all the way to the full-on development of a perioperative surgical home model. So we provide that level of detail and service, all of the risk stratified procedures, laboratory consults, and things like that. We can do all that to the day of surgery. And typically, our locations, we have assigned a medical director, and typically the responsibilities of that medical director at that particular location are to facilitate case management throughout the day. So, the back to the improve every outcome, we never want to have a situation where a surgeon has an add-on case and you get to the point where the anesthesia team cannot do it because either they don't have the right amount of staff or they're not in the right place at the right time. And so the operational efficiency of the OR suite is something we pay particular attention to, because the reality is hospitals, independent or private, surgery centers, the revenue generated for a fully functioning operating room is significant. And so downtime in an operating room is essentially a lost revenue from the business side of medicine perspective. So we pay particular attention to that. We've lived it in the sense of, academic medicine, private practice medicine, level 1 trauma, to our, cash paying, cosmetic plastic surgery centers and things like that. So that whole gamut we're very familiar with, and we recognize the benefits of operational efficiency, and that's what we bring to the table.
That's awesome. And I did notice that Dr. Huey is now on the line.
Very good.
He's coming on here. There he is.
Hey, everybody.
Welcome. Awesome. Hey, I'll have to say, David filled in just incredibly well in the spur of the moment. I know for our viewers, you were delayed in the operating room, and it's always good to have somebody you can pass the baton to.
And Dave is more than just a little capable of that.
Absolutely. So welcome, Jarrod, to the show. And I'll back up. I mean, Dave was covering a lot of things about the difference and what makes you guys unique and the services you provide that are different from others. But why don't you share with our viewers, how did Concordia come about? I mean, what was the thought there years ago, and how many years have you been operating out there?
Two great questions. We started in 2010, so we're approaching our 11th year of continuous operation. Started effectively in July of 2010, and it's a great story. I was with, in fact, Dave and I were with another national anesthesia practice management company. Back then, I was chief medical officer, and Dave was an anesthetist that worked in the organization. In fact, he was a chief anesthetist at one of our hospital facilities around the time that I was chief medical officer. And just through a series of events, some leadership change at the organization and culture changed at that particular organization that just created an opportunity for Concordia to kind of reconstitute and become just a different sort of practice management company. The thing that I like most about this other organization, at least when I started, is it was a physician-led organization, and it changed into something that really didn't value physician leadership. And so when the opportunity came, I wanted to kind of create an organization that really brings together a lot of different types of anesthesia practices under one sort of umbrella. The small single specialty anesthesia practice at one location, a bigger organization that multiple different locations use the economy of scale of the larger umbrella to create this Concordia ideal. And that's the whole concept behind the name and the brand itself.
That's awesome. I mean, what have you felt like in those 11 years you've been able to impact in the anesthesiology management, arena?
It's, the past several years, it's just been a constant change. Throw in it the whole COVID pandemic part in recent months, but we've shifted from just a fee-for-service sort of model and slowly moving into a fee-for-performance model. That's sort of been slowed down too. But I think the thing that has challenged a lot of anesthesia groups is really making that leap. It's one thing to just be able to do a case no matter what the outcome is and get reimbursed for it. It's another thing to kind of build your practice around making sure that you make the best outcomes for the patient, the surgeons, and the hospitals that you're working with in order to be successful. So trying to graduate many of our practices and the anesthesia providers that we work with into that sort of mindset has been one of the challenges that we've managed, and I think we've done it successfully.
Awesome. What technology has played a role in how you do business today?
A couple of different platforms on that same theme, really just try to track our performance. We use a platform that we very purposely use to track just the anesthesia record, the basic part of what we do to manage a patient in the operating room. But we developed some hard stops in that application, in that platform, to answer specific quality questions. And the whole point is that we can, throughout every patient encounter, every patient experience, we can track our quality metrics and deliver it to and provide it to our to our surgery center partners and our hospital partners. That same platform also, again, part of that same technology, helps us to decrease our revenue cycle time too. Instead of having to get a stack of anesthesia charges and submit them online or mail them to the anesthesia billing office. Once we close that file, once we close that anesthesia record, it automatically shoots that charge, that anesthesia record to the billing office. So it decreases our revenue cycle tremendously. And an extra added benefit, it actually captures more data points as it relates to billable services that we do. Certain things that a lot of times you get so used to doing anesthesia, you don't think about the charges or the value that you're adding to that service. Certain things like the age of a patient adds a level of acuity to that patient experience, that encounter. And this technology captures all of that information, the quality, the billing records, the time frame for the revenue cycle, and just pushes it to our billing office, and captures the quality for us to share with our partners.
Well, that's so important because technology is changing so rapidly, and you got to move quickly. And larger organizations have a difficult time doing that. And I know with the way you run the management practice, when new technologies come available, you're able to implement them a lot faster, which helps certainly your clients that you have to be more efficient. What would you say, like when you look at the landscape ahead, where do you see anesthesiology and the management of it? Do you see it changing in the next 2 to 3 years dramatically?
Well, probably not in that short a period of time, but I think there's definitely sort of a consolidation. There's just a restructuring of anesthesia and the delivery of anesthesia services kind of across the board. I think large hospitals, large hospital systems are going to gravitate toward the big corporate anesthesia practices. I mean, that's just the nature of big hospital systems.
Sure.
They're not being critical, but they're probably not going to be as lean and adaptable as a smaller anesthesia group like ours is, and they're going to require the sort of bigger bandwidth, even if it's at the cost of efficiency of a larger organization. Our market is just so focused on smaller anesthesia practices, surgery centers, multi-specialty, smaller hospitals, and smaller hospital systems. What we can adapt to and just kind of deliver a really boutique level of service to, and that's who we're interested in. We actually don't want to be a partner to a large 20 hospital system, because that challenges the service and the quality that we're able to deliver on a scale.
Well, that's so important. I mean, you know where you fit in the marketplace, and you know the type of clients that will respond to your level of service. What type of anesthesiology type practices are you currently, doing business with?
So
Maybe.
I think the question is just how.
Is it an eye plastic surgery? What type? Are there any specific ones that you've had great success with that our viewers can understand the type of people that you serve best?
Actually, yes, that's a great question for sure. We have a very a great mix of anesthesia practices, from single specialty, single room operating room facility to multi-specialty, multiple different room ambulatory surgery centers. Again, our market is smaller hospitals, and we've had relationships with smaller and to mid-size and even some larger hospitals, but from eye surgery centers, plastic surgery centers, orthopedic surgery centers, urologic surgery centers, and again, several different multi-specialty, multi-operating room places that we service.
Awesome. I'm going to put up on the screen too, while we're talking, Stefan does handle questions, and he's available to schedule a discovery call. So if you're currently out there and you want to look at your options as it relates to managing the anesthesiology management part of your practice, just get a hold of Stefan at the number on the screen, and he'll be glad to talk to you, and understand your business and where there might be a fit. So that number's there. So what other challenges do you see in what you do today? Maybe, David, I'll throw it back to you and give Jarrod a minute to off while you handle that one.
Yeah, I think that the challenge for us is twofold. One, finding the partners that kind of view our brand of service and value our brand of service, and are interested in kind of our scalable, adaptable approach. I mean, there are folks that, like to Dr. Huey's point, there are folks that value scalability, adaptability, high quality in being physically responsive, and then there's some other practices, some of the larger systems that are just like, hey, look, we get that, but we need something big, and that's just what we need. So finding that appropriate partner is one of them, and then the other partnership that we're seeking is on the employee side, both physicians and anesthetists, you know, looking for and valuing employees that approach, you know, the delivery of clinical anesthesia at a very high level and take pride in what they do. And all are professionals, but you know, we have a very boutique type of firm, and it's very personable. And people are our power, and so finding those folks that share that same value is something. I won't say it's a challenge, but that is something. It's finding somebody not only with the right skill set, and Jarrod and I say this all the time, the right skill set, but more importantly, the right mindset. And we want people that think about the delivery of anesthesia care and the business of anesthesia the same way we do.
Yeah, it's so important to have that culture that has that philosophy, because you're unique and different in the marketplace, and that's certainly one of them. Any other parts of what you do you want to share with our viewers today as we kind of wind down?
For me specifically, or both of us in general?
Yeah, anybody wants to jump in, I'll just throw it up there.
Dave can jump in because he talks a lot.
I totally
yeah. Having jumped right out of the operating room, he needs to take his breath for just a second. So, go ahead, Dave.
No, listen, I think we've kind of hit the highlights of kind of what we're all about. And I'm just going to say it again to wrap up my thought process. We are a full scope boutique firm designed under this basic idea of improving every outcome. And as I said earlier on, before Dr. Huey came on board, is that improve every outcome applies to every single engagement, from the first exploratory phone call when you pick up the phone and call us, to the negotiation period, to launch, to full up, you know, delivery of anesthesia services, down to the patient we serve. Improve every outcome is a quintessential value. That's what we represent. That's what we want to deliver. And I think that's our market differentiator.
That's right.
Oh, that's awesome.
Very well said.
I do want to say to our viewers that that we will have some of your clients. We'll be interviewing on a regular basis some of the people that you currently, you know, service. So we look forward to bringing actual people that are right there in the practice and using the anesthesiology that Concordia provides. So we'll keep you posted on that. Thank you both. I know, Jarrod, you got stuck in the operating room. That happens. You can't just leave and say, I've got an interview. And it's nice to know that Dave is there, ready when needed. And thanks, Dave, for being on the show. And thank you both for what you do out there and the service you provide.
Thanks.
Thank you very much for your time. Appreciate it.
Y'all have a great afternoon.
Thank you.
Thanks. Have a good day.